E vou passar agora para inglês, por atenção ao nosso primeiro orador, que vai abrir a nossa reunião científica, é o Dr. Christian Panait. Christian Panait is the medical expert for the European Agency for the Safety of Aviation. And he's going to open our scientific program today, which is a great honor and pleasure to all of us. And of course, he's going to start with the topic of the moment, issues related to medical certification, post-COVID and post-anti-COVID vaccination. It couldn't be more topical than this. So I'll pass the floor on right away to Dr. Panait. And welcome and thank you for accepting our invitation.
Boa tarde a todos. Thank you very much for inviting me. It's an honor to be there, even if only virtual, but it's a pleasure to be next to the Portuguese Society of Aerospace Medicine and to ANAC in presenting this paper and explaining a bit of what the European Aviation Agency has done for the COVID development. I will not go too much into the introductory speech. I will go directly to the paper, if that is okay with you. I'll try to now share my screen. I'm hoping that you will be able to see the screen here, and would be good if I would get a confirmation of this. Yeah, okay. Perfect. Then we can go on. The first I will show you a bit about the work that the EASA has done and how we started with the COVID activities. In the basic regulation of EASA, there is one Article 91 which says that the EASA shall contribute to timely response to and mitigation of aviation crisis. Of course, we know that COVID is not an aviation crisis per se, but it impacted quite a lot the aviation sector. So we had different meetings, participation in specialist bodies, worked with crisis management teams of the European Aviation Crisis Coordination Cells, as well as the European Commission crisis teams on public health emergencies. We had discussions at international level as well as within Europe, and developed guidance with various stakeholders, starting with ECDC, but also going to ICAO and Eurocontrol. Most of them were published on the EASA website. Some of them were also published on our partner websites and were distributed throughout aviation. In the next slides, but I will not focus on this, I've put them mostly for information, as the paper will be distributed to you by the organizers after the meeting. There are some of the guidance materials and documents that were published by EASA, some of them mandatory, others staying as at the level of recommendations only. We started quite early in the evolution of the pandemic. We issued the first safety information bulletin on 27th of January 2020, when we had, by coincidence, the first case positive in Europe. We continued throughout the years, last year and this year. The most or the best known would be the EASA ECDC Aviation Health Safety Protocol, but also we had several other guidance for different topics, for crew training, for safety of passengers, for cleaning and disinfection of aircraft, and so on. Early this year, in 2021, on the 7th of January, we also published the guidelines for the aeromedical centers and aeromedical examiners, which I think is the document that is mostly of interest to you as medical examiners and part of the aeromedical centers and the aeromedical world. all the documents that we looked at and all the work that was done in EASA was for the purpose of reaching a harmonized approach across EU and also promoting a harmonized approach at global level. This can be only obtained via coordination, communication, and proper planning. We started with, of course, where the period of the beginning of last year where all the aircraft were grounded and everything was stopped for a couple of months. And this led to aviation to suffer quite a lot through the reduction in number of flights, layoffs of personnel, uncertainties related to job and existence of operators. Then, following this period, the restart was quite shy, so it still didn't go up as we expected in numbers. So we started looking at deterioration of skills. On top of this, or as a result of all of this, we started having anxiety among crew members, flight crew, but also cabin crew, and ATCOs as well, regarding the infection. Already at the second wave, more and more people were impacted, and either directly or their families. The extensive isolation, the lockdown periods, also with reduction in social interaction had a major impact on the crew members and ATCOs. All this, while having an impact on well-being and mental health of aircrew and ATCOs, would mean ultimately also a negative impact on flight safety. And this is actually what EASA and the national aviation authorities are trying to ensure. We are working together to return to this part of the flight where everybody is taking off, but doing so in a safe manner. This is part of the European Union program for stimulating the recovery of the travel sector. How can we do that, or how were we trying to do that, is by using various tools. We used safety directives, which are tools that are mandatory, but also safety information bulletins, which are a strong recommendation, or only guidance and guidelines or safety promotion materials. Now to go more into a bit of a technical medical discussion. It is the assessment of the positive cases, basically what we do with these positive cases. The AMEs should give attention to the anamnestic interview. Make sure that they take all the anamnesis in detail, mostly regarding the respiratory condition, pre-existing medical conditions, requiring medical assessment or hospitalization. In case there is a positivity found, COVID-19 positivity found in the medical history of the applicants, further details should be also required and reviewed, including clinical data from the time of the positive period, vaccination history, type of vaccine. We know that the vaccines have different effectiveness, but also different types of administration, different periods between the doses, if there are more doses required. Number of doses, date of inoculation, whether or not they had any side effects at the time of the vaccination. Also, requiring complementary testing if the history is behind, then trying to receive or obtain medical lab tests and imaging tests from the time of the hospitalization. Also details regarding the treatment that was provided, including the oxygen therapy and if the patient required assisted ventilation. All these are of support for the AME to be able to make a decision in terms of fitness, to be able to make a decision in terms of clinical indication for additional investigation, and to be able to identify whether or not a fit assessment would be possible without any restriction, or it would require a limitation and review at a later date, or if they are temporary and fit, or if it's a complicated case, then if they need to further refer the case to the medical assessor of ANAC in your particular case. This slide presents you also with some pointers in terms of detection and transmissibility periods. That is helpful for AMEs to identify in which phase the applicant is, if they are more or less contagious or not, if they should be suspended temporarily because they might be contagious, or if that period is behind them and they can resume flying and so on. So this is to summarize all the information on one slide. We used different sources to put this slide together, and I'm hoping it will be helpful for you in your day-to-day work in the practice of AME or in the Aeromedical Center. Of course, the assessment of fitness for aviation is a more or less parallel pathway to the existing healthcare pathway. So we have the treatment, we have the primary care physician, the general practitioner or family doctor, the hospital until all the treatment and until discharge from the hospital, and then we intervene from the aeromedical point of view with a review of the documentation from the hospital, the discharge documents, and assurance that they may be safe to fly. Here we are looking at the possibilities from the review, but we are also counting, and this is the small arrow towards MED A020, which is the decrease of medical fitness. So we are counting also on the self-reporting obligation for the applicants, for the pilots, cabin crew, ATCOs, to come and discuss with their AMEs after they have been positive, after they have been hospitalized, and even if they were not committed to the hospital, at least to come and discuss if it was an asymptomatic or mild symptomatic case that was not requiring hospitalization. They should go and discuss with their AMEs. And the advice that you will also find in the guidance for the AMEs and aeromedical centers is to already discuss with your applicants when you see them, when they come for your medical, and inform them that in case they will become positive in the future, they should come back to you and discuss potential options to ensure the safety of flight, but also their safety, having in mind that respiratory condition could be further enhanced by the cabin environment. For the fitness assessment, this is just a reminder. Of course, you all know all of this. The AME should ensure that the medical requirements are respected at all times, and that you are performing everything in line with the regulation. You should take in account both clinical perspective and transmissibility in your assessment, and should inform the applicant that they should provide you with a full visibility of their data. So Going now towards the sequela of the COVID-19, which is, again, one very important point that we need to discuss and we need to tackle in our day-to-day work. Patients that have suffered from COVID-19 infection can have or may have for unknown periods of time neurological sequela, respiratory, vascular, sensorial, or they may affect, they may disbalance existing conditions like diabetes mellitus, mental health issues, renal problems, and so on. So this is not an exhaustive list, of course. Other systems may be affected as well. So further examination may be required, of course, to identify this, but everything starts from a very well and thorough anamnestic discussion with your applicants. Monitoring this sequela may require regular specific examination, and for that reason I told that there is a possibility to put limitations that would require applicants to undergo this regular specific examination, and this should be done in coordination with your medical assessor of ANAC, with Marcos respectively. Very quickly, jumping to an issue that is quite important and is not visible in the at the first look, and that is the mental health and well-being. And I mentioned earlier that COVID-19 and all the consequences had a huge impact on mental health and well-being of pilots, ATCOs, and cabin crew, but not only them. I'm referring in the presentation mostly to them because they are beneficiary of licenses, of medical certificates in the European system. But we also have ground or flight engineers, we also have handling crew and so on. So those were affected also, and you should consider them also if they are your patients. So losing loved ones, isolation, reduction in competence, job uncertainties, possible sequela, even spending more time home with the families had an impact. For some that was beneficial, but for others it required a change in their day-to-day customs. They had to adapt to being home with the loved ones more, and that had an impact on their well-being. That changed a bit their mentality, their way of coping with various stressors. And we need to ensure that this is coped with and this is solved before allowing them to go back to flight, in order to ensure that the flight safety is respected. What we expect from AMEs, or what do we encourage the AMEs to do, is to have direct contact with the applicants, to listen to them carefully, explain to them what is the situation, what are the changes, and advise them how to react to those changes. Yeah? Not forcing them into anything, but trying to be supportive from the AME side. Try to explore the current situation and to assess the mental health problems or alteration of well-being, considering the fact that sometimes denial is one of the early symptoms of any mental health issue. So then self-reporting will be a bit more difficult for this particular type of pathology. So be supportive and encourage them to open up to you, discuss with them, explain to them they should not be afraid of losing their medical certificates or other things, and that this is for their safety, and you're there to help them continue their career in a safe way. Aviation safety, of course, I mentioned it several times, and we can ensure that directly via the AMEs, via the medical examination, but that can also be done at operator level by support groups. And I think during these days of conference that you have seen various systems put in place by operators or by the national authorities. In the end is to reduce overall stressors and to identify stress coping techniques that would be suitable for each individual. Going to the last couple of slides towards the vaccination part, we have a safety information bulletin recommending vaccination and also advising a period of waiting before resuming active duty after vaccination of at least 48 hours. Recently, 2 studies were published by US CDC and by Israel regarding the booster vaccine, so the 3rd dose for the vaccines that had 2 doses, where they show similar levels of adverse reaction, so not an increased number of adverse reaction compared to 2nd dose. So this is a positive thing. We don't need for the time being to adjust. We will still keep the recommendation for 48 hours waiting period. AME should also remind the applicants of their obligation regarding the decrease of medical fitness, namely in case that side effects will take longer than 48 hours, they should report that and continue to not work until the side effects disappear. And last but not least, monitoring of reporting of the side effects or adverse reaction to the CAA would help will help ANAC and would help us from EASA side to have an overview on how these adverse reactions are distributed, and if we need to change anything in our recommendation in order to maintain safety. You will find in the PDF version also a small flowchart on how this should be judged. Basically, it's more or less in line with the policy, with the national policy, and can be also customized to your national policy. And the last slide, lessons learned. The main lesson that was so far is that harmonization is the key, and that we need cross-domain and international harmonization of measures, as well as mutual recognition of measures, including mutual recognition of vaccination, in order to be successful and to have the same approach everywhere and to ensure safety at the same level. Of course, we are starting research activities to try to identify ways in which we can facilitate earlier reaction and to cope with such pandemics. Preparedness planning and facilitation, that is another stream that we are following within EASA and also together with ICAO. Obrigado a todos for listening to me, and I'm open to your question. I want once again to thank to Rui and to the Portuguese Aerospace Medicine Society, as well as to ANAC and to Marcos for inviting me and having me here. I'm here for your questions now.
Thank you very much, Christian. That was a very comprehensive overview. And I especially liked in your last slide the word harmonization, because this has been certainly one of the biggest difficulties we have faced since the pandemic began, harmonization across Europe and across the world. Fortunately, I believe with the EU vaccine certificate, the EU has certainly moved forward quite a bit as far as harmonization of procedures is concerned, and I think we can all be very happy for that. I have a couple of questions. I believe Marcos will have a question too. Christian, can I just ask you, during this, the last few months and since early 2020 and when the pandemic started, what were the difficulties of certification across Europe that you saw as, you know, the top of the pyramid of the whole process? Were many authorities having to close down? Was there a pile-up of certifications that had to be dealt with at a later date? Do you feel it's stabilized now?
Yes, initially, especially March and April last year, when we had the longest lockdown, there were some issues for multiple reasons. As you said, some of the authorities also locked down and had to switch back to teleworking activities. Many of them had electronic systems, including medical certification electronic system that helped them a bit. But still there was a major problem. And for that, we had some exemptions allowing an extension of validity for some of the medical certificates, subject to not having other medical conditions. In some other countries, AMEs, as well as the medical assessors in the authorities, were asked by the public health authorities and Ministry of Health to help with the management of COVID. So they went back to their clinical medicine, dealing with COVID patients, dealing with testing and so on. So they had to abandon their aviation medicine or reduce it to the maximum. Right now, the situation is good. We don't have, at continental Europe, we don't have any issues. Most of the AME practices are open. There are some issues in some of the remote areas from France, remote areas outside of Europe. Some of the pilots that are working for operators outside of Europe, for example, the predominant parts are for the ones that work in China, have difficulties to reach European AMEs. And for those, we are still trying to help them in some way. But at European level, of course, with the bad situation where some of the AMEs also lost their lives being victims to COVID, which was very unfortunate. But everyone else is back in full work, so we don't have any reports that are still difficulties right now.
Okay. Marcos, would you like to come in?
Yes, not exactly a question, but more a comment. I've been gathering all the cases reported by the AMEs, and the almost totality, I have already 100 cases registered. 99 of them were just cases of positive tests, small symptoms, and no sequelae at all. We have only one case of one pilot that was admitted to hospital, admitted into intensive care, and later only he came to revalidate his medical certificate only after declared cured by the normal health institutions. And so at the time he came to us, he was already fit for flying. So
that's a very good statistic, and I think not in all cases, but in many of the countries have similar statistical data, and that is specifically because air crew members and ATCOs, due to their annual checkups or regular checkups, are mostly healthy people, healthy individuals that in most of the cases perform their vaccination depending on their area of operation and the period of the year, flu vaccines, yellow fever and so on. So they didn't have pre-existing pathology, and that helped quite a lot to have asymptomatic or very mild situations. So I can say that I'm happy of that, and would be good to, this is the plan for the future meeting with the medical assessors of all the NAAs to discuss each experience and see if we can identify problems in any of the areas. Hopefully not.
Yes, thank you, Christian.
Okay, thank you. Christian, we have only a couple of minutes left, and I can't resist but ask you about something non-COVID, just for a change. And, well, it's actually as important. So once we get past this whole crisis, and I'm not going to ask you for any forecasts or predictions, don't worry, but I'm sure there's other issues at hand that EASA medical certification finds that are as priorities for the future as well. Could you just give us an idea of what is priority for EASA medical for the next few years, apart or in addition to COVID, of course?
Yes, that's a very good question, and I'm very happy that you ask. Actually, we are right now drafting the technical material for some research activities that are related to our priorities in the near future. And those are related to diabetes mellitus and HIV positive pilots. Also, we are looking at cardiovascular disease and trying to update the requirements related to the updates in the technology. We are looking also at the mental health issue. We still have some work to do there on this topic. It's, I think, one of the most difficult, but also one of the most important. And we saw that with the most recent major accident in Europe with Germanwings a few years ago. And also not to forget that we have more and more activity related to drones. So there we will have some activities related to the medical certification of the drone operators. So these are a few of the topics that we will tackle in the near future, and hopefully as soon as this COVID will be finalized or at least contained in some way, we will dedicate our time to this project.
Do you think it likely that drone operators will have their own certification class?
For the time being, we have put the recommendation of ICAO to keep class 3 for the big drones, for commercial activity. But there might be that also for the intermediate, we may consider some medical certification class for their own, or maybe merge it with LAPL, with the leisure pilots. We don't have a decision there yet. It's a project that we need to do, but we, due to the COVID in the past 2 years, our activity was more or less paralyzed. So this is a topic for discussion for the future congresses, to get a medical opinion, to get operational opinion on this, and see where we stand and what is the way forward.
Okay. Thank you very much. Time has reached its end, and obrigado, Marcos, também por participares nesta pequena mesa redonda, and hope to see you soon at another meeting where hopefully COVID will be a topic of the past. Thank you very much again,
and
Christian.
Hopefully we'll be able to see each other face to face rather than via virtual means. Thank you very much to everyone, to all your participants, and to you for inviting me.
Thank you. Bye-bye.
Bye.
Thank you, Christian. Until our next meeting.